Now let's look at a picture of a cadaver and try to find the brachial plexus. So you guys, your brachial plexus comes out between the scalenus anterior and scalenus medius muscles. So you have your roots, all right? So once you look at the cadaver, you will find the C5 followed by C6, and they unite together to form the superior trunk. And then the C7, we're going to continue alone, forming the middle trunk. And then C8 and T1 is hidden down, and together they will form the lower trunk. So these are the superior, middle, and inferior trunk. And the point of the formation of the superior trunk is formed the Erb's point, which is approximately 2 centimeters above the clavicle. And that Erb's point is important because we're going to talk about if we have an injury here, that will give me something called Erb's paralysis. And we called it Erb because that belongs to the neuroanatomist. His name is something Erb, so that's why we call it Erb. And we will have another injury that belongs to the lower trunk, which is called the Klumpke's paralysis, and that is also called as such because Klumpke is the name, the last name of the neurosurgeon. One of them is neurosurgeon and the other is neuroanatomist. Anyway, so that's what's the. I like just to give definitions and what we mean by terminology in anatomy to make your life easy. So this is what we call the injury to the lower trunk. And we're going to talk about that once we're done with the brachial plexus itself. All right, so in this picture, we are looking at the roots and the trunks. All right, and this is your axillary artery. Let's proceed and see. Do we have anything here? Yeah. We have a nerve that is coming out of the superior trunk. You're gonna find it coming out of the superior trunk, guys. So this is 5, 6 that are uniting to form your superior trunk. And then you will find a nerve that is going all the way back towards the scapula. So what do you expect that thing to be? It's not gonna be, of course, subclavius because subclavius muscle is not here. This is definitely the suprascapular nerve because I know that from the superior trunk I have two nerves, the suprascapular and nerve to subclavius, and this is the suprascapular. Now we have a nerve that comes all down and it goes to the serratus anterior muscle, and that nerve is coming from C5, 6, and 7 roots. I can catch it here when it's falling on the serratus anterior. I don't need to see it from the roots. It's very difficult to see it in the roots. So if we were to ask about those exam questions in any practical exam, we will spot the nerve at that point. So once you see it coming from brachial plexus going to the serratus anterior, this is your long thoracic nerve or nerve to serratus anterior. And the other nerve, which is very thin, it runs back, it comes out of C5 and it goes to the levator scapulus and rhomboids. This is your dorsal scapular nerve. So in this picture, we've seen the roots, the trunks, branches of the roots, and branches of the trunk, only one of them. All right? Now, as we proceed with the brachial plexus, again to orient you, this is your scalenus anterior, this is C5 and 6, this is the superior trunk, this is 7 and middle trunk, this is 8 and T1 is hidden, giving us a lower trunk. Now, once you come down, your axillary artery is basically here. Right, so it's just coming down a little bit, but the axillary artery should actually be here. So what is posterior to it is the posterior cord. What is lateral to it is the lateral cord. What is medial to it is your medial cord. And this is the M letter, you guys, that I told you about. Your M letter, once you see a nerve, a root coming from the lateral cord, a root coming from the medial cord, forming nerve in the center, this is going to be the median nerve. And the lateral limb of the M letter is going to be your musculocutaneous nerve. And the medial limb of the M letter is going to be your ulnar nerve. All right, so this is the M letter. For the radial and axillary, I wouldn't like to show it to you guys with this picture. I'm going to show it to you in a better picture. Can you guys look at this picture? Can you see the axillary artery? It's a tubular structure that has a lumen. Remember when I told you in the previous videos, I'm gonna tell you how to spot the axillary artery out of everything. Axillary artery, guys, comes in here. You have the lateral cord lateral to it, posterior cord posterior to it, but of course we've pulled things away to show you the posterior cord, but in reality axillary should fall here, and this is what you will see in the dissection hole if you want to look for the structures, and the axillary falls here. So lateral cord, posterior cord, and the medial cord is medial to it. It's hidden now. Now this is the M letter. So this is median nerve, which is formed by two roots. This is the musculocutaneous nerve that wants to pierce the coracobrachialis and takes care of everything here in the anterior arm, and then it goes to the lateral cutaneous nerve of the forearm. And then the M letter, so you would spot a nerve coming down here all the way to the ulnar side, and that is what we call the ulnar nerve. All right, so this is the M letter. Now how can I see the axillary and radial? Remember guys, I told you we have a nerve that runs longitudinally and it goes all the way to go out, and we're gonna talk about how they come out of this compartment in the arm, and we will see that we have something called triangular and quadrangular spaces, which is one below the teres major and one above the teres major. We have lower triangular, we have upper triangular, and we have upper quadrangular. I'm going to explain that in the arm. It's not important now, but the only thing I want you to know is the nerve that comes down all the way and it exits and disappears here. This is your radial nerve, all right? And then the nerve that goes and wraps around the surgical neck, this is a nerve, guys. This is the axillary nerve. Someone will tell me, okay, this is confusing me. No, it's not confusing, because this is your axillary, guys. Axillary nerve, axillary artery, it goes all the way, all the way, all the way, and then once you are down to the teres major muscle, it will become brachial artery. So if you can see the axillary and you're sure it's a branching structure, if you see a branching structure, this is definitely an artery, not the nerve. You can see a lot of branching coming out of this structure. So if you can look at this all the way and you can see a branch coming out of it, big branch, and it goes out with the axillary, this is your posterior circumflex humeral artery. So this is artery and it's not confusing, and this is nerve. It's coming from the brachial plexus, from the posterior cord. It's not confusing. So this is the nerve and this is the artery, and nothing else is coming out from that space, which is the quadrangular space. All right, we're going to talk about the spaces later on, but once you see something that is exiting the region, this is the nerve and this is the artery. And now someone will tell me, okay, this is confusing. No, this is not confusing, because this is the deep brachial artery, and the deep brachial artery is coming out from the brachial artery, and the brachial artery is the continuation of the axillary artery. So if you can see an artery, so this is an artery, and this is a nerve. It's coming from the posterior cord. So if you can see a nerve, so this is the radial nerve. If you can see an artery that is trying to also exit with the radial nerve, this is the deep brachial artery or the profunda brachii artery. All right, so nothing is confusing. Once you understand the whole thing, everything is going to be easy. All right, so this is the axillary artery, and these are the branches of the brachial plexus. People coming from lateral cord, the M letter, people coming from the posterior cord, and their relation to the axillary artery. And we already explained the branches of axillary artery. But at this point, you now know how to differentiate between the axillary artery and the cords of the brachial plexus. And for the branches themselves, you can go ahead and watch the previous videos. All right, and this is, guys, a very nice picture to show you how the brachial plexus is, the roots are coming between the two scalene muscle, and once you form the trunks, and once you have the axillary, you will have the cords. Now what concerns me is that as you go with the artery, this is the artery, this is the brachial artery. I just want you to see how, if you see a nerve, it's not coming out of the artery, so this is axillary nerve. It's trying to go and wrap around the surgical neck. And if you can see two arteries coming from the third part of your axillary, you have a thinner one, which is the anterior circumflex humeral, and a thicker one that is trying to wrap around with the axillary nerve, and which is what we call the posterior circumflex humeral artery. Now, as we proceed with the brachial, once you are down to the teres major, this is, sorry, as you proceed with the axillary and you're now down to the teres major, you are the brachial artery. The brachial artery, here it runs here, and then it exits from the lower space, and this is what we call the deep brachial artery or profunda brachii artery. All right, so this is a very good picture in showing us how the axillary artery is different than the posterior circumflex humeral artery. Okay, you can see that the artery comes out of the artery and the nerve, it just appears. It's basically coming from the posterior cord and running here. All right, guys.